morning, everybody, and welcome to this session on DNB practical examinations being conducted by TIPPS. So as you all know that on February 3rd, there is the DNB practical examination which will be conducted. And we got a few requests from members of the group for some suggestions on the pattern of the exams. So what we thought is that it would be a good idea to invite a couple of our academic coordinators who have given the DNB exams recently, so that they can share their experiences and also the format that they had faced. So I think sharing their experiences would be useful to those who are going to now give the exams. And especially with DNB, sometimes there is some anxiety that is associated with the exams because of the format of the exams. And additionally, last year, I think an OSCE format was introduced, and which is not very familiar to the PGs here. So let's have a discussion today and clarify all these doubts. So we have with us today Dr. Vijay Raj Pratik, who is an assistant professor in SVS Medical College, Mehboob Nagar, and he gave his DNB in September 2021. And we have Dr. Penubarti Shravanti, who is a senior resident in the Kamineni Institute of Medical Sciences, Narkatpalli, and she gave her DNB exams in June 2020. Okay, so let's invite both of us and both of them, and let us hear their experiences and the format of the exams that they had given. And then after that, let us take up your questions.
Should I start, sir?
Yeah, Vijay, you can start.
Yeah, good morning, everyone. I welcome everyone. And so I would like to just start with saying that DNB is not much different from other practical examinations. So don't worry about on how to give what to expect. The questions are as common as in your MD exam and your DNB theory exam. So don't worry about the practical exam much. First thing, I will share my screen and share a presentation on how the pattern has been changed last time and this session. So we'll have a discussion later on what to expect. Yeah. So I think my screen is visible, sir. Yeah.
Yeah, it is visible.
Yeah. So there was recently a notice of the NAT board examination. This was the notice given on 17th December, where they have described as virtual OSCE, clinical case examination, ward rounds, and Viva voce. Virtual OSCE is about 100 marks, and case examination of 100 marks, and ward rounds of 40, and Viva voce of 15 marks each into 4. Total 60, total of 300 marks. So last session when I wrote, it was a similar pattern, but marks were redistributed. More preference was given to OSCE component of 150 marks. So there was a webinar conducted by DNB also at that time, web meeting conducted on how to acclimatize to the meeting, to the exam. So some of them are screenshots of what they have said. So this revised pattern consists of a total of 4 components, that is OSCE, Viva voce, ward rounds, and clinical case examination. Okay, these marks are from the last session, so don't worry about these marks. Yeah. So it was given that OSCE component that candidates will be inside the examination hall with blank answer sheets, and there will be around 20 for this session, 20 OSCE for this session. So you'll be given each a sample sheet or an answer sheet of 20 sheets. Initially, they will give each sheet to write the answers. So they should mention their roll number, station number, and also the question number on the sample sheet. This will be shared by NAT board themselves from on a virtual platform. Online. Okay, these OSCE component will be shared online from the NAT board Delhi center. So generally time allotted is 4 minutes for last time, and there was break for every 6 to 7 stations. Okay, after every 6 to 7 stations, there are 20 stations. So maybe you might get for 6 stations a break. After each 6 stations, you can get a break. but there is the logic is there is time limit for these things. It's only 4 minutes. Maybe they increase to 5 or 3 minutes as of now. I don't know, because they have not described how many minutes they're giving, but it is time limited, definitely time limited. And answer sheets are single blank page. They'll be given only one page for one station. So be careful with that. And so this is a sample answer sheet given by NB. So you'll just have to write on the front side of the answer sheet. You should not write on the back side. Whatever answers you have, you should write on the front side of the answer sheet only. Okay. So they ask to use only ball pen or dark blue pens, and these answer sheets will be evaluated by NB NAT board. So the problem here is within 4 minutes, you have to read the question and write the answer. So answer should be very brief, technically in words, 2 or 3 words, or 1 or 2 sentences, not more than that, and should fit in a single page. Suppose one OSCE, one station will have 4 to 5 questions. So you have to number these questions and write the answers. Don't be very long with your answers, because they'll be asking you specifically. Write brief answers of what has been asked only. Okay. After each station, after the 4 minutes is completed, they will take away your paper. So be careful with that. You cannot remember the question and write the answer later at a later point of time. Whatever you have to write in this 4 minutes. I know this is very strenuous, so make a writing practice for this. I advise make a writing practices for this. So technically, these OSCE questions are clinical based questions. Most of them are on management questions, on what you prescribe on day-to-day life for depression, panic disorder, etc., and how you start clozapine, lithium, how you treatment-resistant schizophrenia, what are FDA-approved drugs, national mental health surveys, and etc., etc. Most of the topics are covered in your day-to-day practice only. But the problem is only that time limit. So please be aware of the time limit. It will be around 4 minutes, and within 4 minutes you have to complete that station. Station is technically 1 slide, 1 or 2 slides with the description of the case or the question, then followed by set of sub questions, which are the components, which will be each given 1 or 2 marks per question. Okay, and these answers technically should be very short and brief. Then we had a Viva voce component. Viva voce component was about 4 stations. These are also given duration, but examiners were not following that much about these duration, because these were physical only. Examiners were present physically. So technically they divided into 4 stations and into 4 different subspecialties of psychiatry. These were given as clinical psychiatry, specialty psychiatry, Indian psychiatry, and recent advances. So in clinical psychiatry, they were asked about all the core psychiatry. How do you manage a case? What are the common cases you see in OPD? What is the common drugs you prescribe, etc. In psychiatry specialties, especially the focused on child psychiatry and addiction psychiatry. Child psychiatry, they asked about autism, on how do you approach a kid to autism, on what are the treatments approved for autism, etc., etc. Also, like what is the prevalence of nicotine dependence in India? What is the prevalence of alcohol dependence? What are the recent surveys? Those are asked in psychiatric specialties, especially mostly concerning on child and addiction. So coming to Indian psychiatry, they focused on Mental Health Care Act, surveys, recent laws, etc. And also they asked about psychiatric societies you have been in, what memberships you have been in, and what are the conferences you have been attending, and all. How do they conduct? Who is the editor and all? Indian psychiatry related to Indian law, particularly related to forensic psychiatry and community psychiatry. But they asked some questions which are about Indian Psychiatric Society also. Then coming to recent advances, mostly recent advances were on biological treatments and recently FDA approved drugs. So these are for 10 marks for us. Probably they have increased now for 15 marks each station. You'll have very short time for these also, maybe 5 to 10 minutes only for the Viva voce. So don't worry about this, but these will be according to specific station. So prepare that subtopics: clinical psychiatry and child and addiction, forensic and community, and recent advances. This will be specially given to the examiners. That stations will be allotted to the examiners, so they'll ask pertaining to those only. Okay. So Then comes the ward rounds. Ward rounds, we had physical cases. NB said that there will be 4 cases, and you will, as in ward, which can be volunteers or real patients, but we had real patients only. And examiners will be there, as if in your, technically in your ward. But this carried out like a short case, actually. They were expecting, examiners were expecting a brief summary and a diagnostic formulation on how do you manage this case. You will be given only 10 to 15 minutes of time, not more than that. For each case, you will get very short time. So whatever you could get in the 5 to 10 minutes, you have to gather it, write it on a sheet. These sheets will not be evaluated, unlike OSCE. This only it will be evaluated by your physical examiner. So examiners will ask about what is the summary. As there will be 4 cases, each examiner will take only 1 case. Okay? It is not that all will discuss all 4. Each examiner will take only 1 case per ward round. So technically 4 short cases. Probably they'll ask about summary, diagnostic formulation, and the management plan of the patient. Okay, this is as per the individual examiners only. Each will take 1, and in rotation, all the exam giving going students will get interns about these ward rounds. So then comes the clinical examination component. So it is given that we in the last session we had 2 cases. One was a virtual case, one was the original case. This is expected to be a long case, so they expect you to take a total case pro forma, do a mental status examination, do cognitive examination, and present a summary and present the physical case. They expect everything. So physical case will be was handled by 2 examiners, and virtual case was handled by 2 examiners. Virtual case, you will be projected a slides of the virtual case with 1 slide for history, 1 slide for present history, 1 slide for past history, and 1 slide for mental status examination. By that, what you conclude and all they will be asking. This is we had 1 virtual case and 1 physical case. I don't know how the session will be as of now, because they have just mentioned 2 cases of 50 marks each. So they can be both physical or else virtual also. So be prepared for that. But these are technically long cases. Virtual case generally, again, virtual case discussion is somewhat different from the long case, which is a physical case. Physical case, they expect you all the case summary and the examination. Mental status examination. Virtual case, they expect you to tell about the management and guidelines and all. Okay. So we had two long cases, and physical examination was required for the physical case. So they asked us to do a physical examination also. For virtual case, it was about 4 slides for us. Then they gave 15 minutes of time, and they asked to write down whatever we want to write on a blank sheet, and then they had a session with the examiners. Examiners were discussing on what the case was and how the management gone. Okay. So there was a time allotted also. I kept one slide for time also. This was the time given for the examination. Generally at that for the last session, it started around 9, technically around 9:30. Okay, and most of the components were finished in the first half of the examination only, before lunch, and lunch was provided by the institute themselves. We should not carry anything to the examination. They themselves have provided lunch and tea. But Viva, ward rounds, and OSCE component all were finished in the morning. Only clinical cases were present for us in the afternoon, because clinical cases and discussion takes more time compared to these things, and they have specifically allotted times for this. Probably this would be the same pattern now, except that reorganization of marks in each component was there. Okay. This was the same pattern 1 year back also, when lockdown was there, where the marks were redistributed. So probably this is what you expect from the examination, from OSCE, ward rounds, Viva voice, and clinical examinations. So my suggested readings are these, particularly go through MODSLE prescribing guidelines, TIPPS, OSCE volumes, and case pro forma and mental status examination, forensic and community psychiatry, synopsis, especially for specialty psychiatry like child psychiatry and addiction psychiatry, and also the surveys and MHS survey. History regarding biological treatments and their evolution especially should help you. These are suggested readings as per the questions they were asking. So this list is not all inclusive. So there might be questions from outside these also. This is just a suggested reading. So I suggest to go through these things at least once, so you'll be thorough with your answers to the examiner. Okay. This is as per the pattern of the examination. Thank you for that. As of now, I think I shared the document on TIPPS group also regarding the same. So you can go through the document if you have any doubts and ask me back. And also I'll share the PPT also if needed. That's it. I think that's it, sir, from my presentation. I can share your experiences based on the questions, sir. Thank you.
Yeah, so there's one question in the chat asking which was your center where you gave the exam.
So I gave my examination in Hyderabad, sir. IMH Hyderabad, Erragata. So it was a Osmania Medical College sub-center. So it was in Hyderabad. And there is a question that when we do get admit card, tentative date is given on the website. It is on February 3rd. So it will not be changed, and the admit card will be generally issued 4 to 5 days prior only. You'll get 4 to 5 days prior only the admit card.
Right. So I think all the people who have questions, please continue to put them in the chat box. We'll take all the questions in the end. Right. So next, I think we'll ask Dr. Shravanti to share her experience of the exam, and then after that, Vijay can again share his experiences, and then we can take questions.
Hi, good morning, everyone. I hope I'm audible to everyone.
Vijay, you can stop sharing. Yeah, thank you.
Sir, am I audible, sir?
Yeah, we can hear you. Go ahead.
So, yeah, I have given my DNB in June 2020 session. So my center was at SCAR, Chennai. So the exam was held in March 2021. So there was a delay because of all the lockdown and pandemic situation. So my exam was in direct mode. So I found like whatever Vijay sir have told now is almost entirely new to me because I have given it in a direct mode and it is more or less equal to MD exam. So there were like 1 long case, 2 short cases, and then 4 stations of Viva. So like the long case which I got was schizophrenia, and then short cases, neuro was dementia case, which was a like sort of bouncer for me. And then another short case is OCD. And the 4 Viva stations were like psychopharmacology, and then I'm sorry, EEG and radiology. The third one is forensic psychiatry, and the fourth one is more of psychological testing and assessment. So all the 4 stations, like 4 examiners were asking about all the 4 topics. It's not very segregated, unlike OSCE or other things. So, and mostly psychopharmacology was concentrated on depot injections and the parenteral modes of other drugs available. And coming to the psychological testing, almost like all tests were asked. And EEG and radiology, I have to say, like the STEPS notes conference which we have attended, the basics of EEG and radiology, that have helped a lot in last minute revision and answering the questions which they have asked about the basics of EEG and radiology. And the fourth one is forensic psychiatry. So in forensic, mainly they have concentrated about the recent MHCA, which was though it is not in practice in most of the places, what are all the expected things and procedures for admission and all. And the other ones of acts which they have concentrated is the POXO Act, which was modified again, and NDPS Act and these things. So that's about like Viva. But whereas like cases were concerned, the long case and short cases, 1 long case and 2 short cases, it is most like our MD exam which we have given. So all the basics. So one suggestion I would like to tell is stick on to your basics, like all the ICD criteria, MSc definitions, and then once you go to the management plan, the guidelines. So I particularly have morely like concentrated on the IPS clinical practice guidelines rather than AP or any other things. And that was the first thing which I concentrated. And then next to the NICE guidelines by Maudsley. So, and then like drugs, side effects, THAVs, everything about the drug which you wanted to tell. So it is not much different from MD exam. And so sticking on to the basics will definitely help you to clear DNB. It's not that difficult according to me. And one more thing which I would like to tell is like, there is one set of series of videos called OSCEs in Psychiatry by Icon Group. I don't know if you have been aware of it or not. So like before my practical exam, apart from TIPPS OSCE book and the EEG notes and all, I have gone through those there are almost like 12 to 13 videos of 1 to 1.5 hours each. So I have actually gone through those videos which like gave an overview of how the questions might be or how the sessions might be. So that would be an added thing to go through to get a clarity about how OSCEs might be asked on different topics actually. So yeah, that would be my experience. And if there is any specific questions, I'd like to answer. Thank you, sir.
Right. Thank you, Shravanti. When did you give your exam?
It is actually June 2020 session, sir. Exam was held in March 2021.
March 2021.
Yes,
sir. Right. So this was, I think, after the end of the first wave. So probably that's why they have gone back to
they have gone to normal
physical examination and the earlier regular pattern.
Yes, sir.
Right. And Vijay, when did you give the exam?
It was in September 2021, sir. It was December 2020's session. I gave the exam in September 2021. Yeah, when after the second wave happened.
Right. So I think, I mean, there is a difference in the two formats. I think what happened in March was more like a the regular pattern, and what happened in September was more of an shorter online with less physical examination, right? And so it's likely that this current exam in February will be more like the September exam.
Yes, sir. So technically, it is not much different from MD and MS exams. The questions asked in the by the examiners are basically the same things. Only thing is, OSCE component, you have to be careful on writing the answers. The 100 marks of the OSCE component, you have to write answers and given the 4 to 5 minutes time. Other thing was almost similar to MD exam, but only the marks distribution was slightly different. The questions asked by the examiners were mostly similar to the MD/MS exams only, like long cases, ward round, short cases, etc. Viva. All those questions were, as Shravanti said, are mostly in pattern of MD/MS only, not much different. And someone asked that was the exam virtual. The exam is not completely virtual; it's physical only. Only that they'll virtually display the OSCE component and the clinical case component. There will be examiners physically present there, and there will be patients present there. Yeah. That was what happened in September 2021.
Right. So, I mean, from what Shravanti says, it appears that she had a long case and short case, just like in an MD exam. So, like you are given 45 minutes to take a case. From what you presented, appears that you did not have like a 45 minutes to take one whole case. Is that correct?
Yes, sir. Yes, sir. For a clinical case, which was supposed to be a long case, they gave only about half an hour time. And the ward rounds cases, for each case, they gave about 5 to 10 minutes of time on, not more than that. Because they have to complete in the segregated time before afternoon, they have to complete the ward rounds, and they have to complete the clinical cases by 5 o'clock and submit it to the NBMS. So it was concised. The time was concised.
Right. So there are, so how many those short cases you had to take? Four.
Four. Ward rounds are technically supposed to be short cases. Those were short cases, 4 cases. These 4 cases were particularly, one was panic disorder, one was about alcohol dependence, one was schizophrenia in remission, one was depression. These were the short cases we had, the ward rounds. They expected only diagnostic formulation, not the full details. They just expected how the episode has started. What are the chief complaints? What is the formulation now, and what is the management you go like with? Not much more than that in the short cases. Ward rounds.
Right. So because generally in an MD exam, there are 2 short cases.
Yes, sir.
Usually it will be like 15 minutes and you're given a specific task like to elicit some psychopathology or something like that. So here, so in 10 minutes, were you able to get information about the diagnosis, management plan? Was it a challenge, or how did you manage that?
Yes, sir, it was a challenge, but in OPD, we generally see follow-up cases in 10 to 15 minutes of time only. So probably the chief complaint should give you an overview of what he has been going through, he or she has been going through. And mental stage examination, not much of importance, because they were the cases were did not have much of findings actually. The one at that time cross-sectionally, they had findings in the history only. By basing on the history and their complaints only, we could come to a provisional diagnosis, not a differential diagnosis, but a provisional diagnosis, and give a formulation. It was definitely challenging, but I would say the cases were communicated, and the patient presence were easily telling about it, because they are already in remission. These are not typically actively psychotic or actively suicidal patients who has to be taken in detail and go into depth with. Their cases in remission who have been on treatment, and they know what to tell and what not to tell. So if we ask about the complaints, and we get an overview and little bit examination about depressive cognition and motivation to quit in alcohol dependence should help. That's it. Not much of positive findings as per psychotic symptoms or suicidal ideation and all. So it was typically a very short case. Just a diagnostic formulation should suffice.
Right. So it is like how you see a follow-up case in an OPD for the first time. Right.
Yes.
So you have some background information and you elicit current symptoms and status, and then there will be a discussion on what should be the future management plan for this patient.
Yes, sir. Yes.
Right. And how many long cases did you have? 2, you said.
Yes, sir. 2 cases. Clinical case component has 2 cases. Now also it is 2 cases. One case was physical case. The long case had 35 marks. Here they gave 30 minutes of time. They expect you to do all the examination as per the long case, from the history of present illness to the mental stress examination at least, then the summary and the management plan. Virtual case, they own. Actually, we had a virtual case also. Virtual case, they gave 15 minutes and the slides were projected. Everything was there in the slides. Nothing much to write over about what to expect. Just the positive findings and the formulation.
So virtual case means it's like a case vignette.
It's a case vignette, sir. It's a case vignette having history in 1 or 2 slides, present history, past history on 1 or 2 slides, and mental status examination and cognitive functions in 1 or 2 slides. So it was presented through NATBO Delhi through a slide presentation. There were about 4 slides for us. A bipolar disorder case vignette was given. Basing on that, the questions were asked. Everything was in the history only. We could not get much information apart from that. Whatever information they gave from the NATBO, we have to take it, write it on a paper and present it. Then they asked for the virtual case. They went more into the diagnostic approaches. What are the criteria you have? What to diagnose? What are the management plans? Different management plans. How do you approach if there is resistance and all? For other long case, they expected examination part more. That was what we faced as in the exam in the last session.
You're right. Okay, so maybe now I'll request Shravanti to just tell us what are the cases that she got in the exam and what was the approach for the discussion that happened with the examiners.
Yes, sir. So long case, what I have got is schizophrenia. So like as per MD, how we get 40 to 45 minutes, we got time was given, and we are supposed to take the entire case, present it with the DD. And the discussion, like the patient was around like 40-year-old female with long history of non-compliance to treatment and all. So the discussion went on like what can be the alternate, and the attenders were not properly reliable. So what can be the DDs, and why not it just a delusion? Delusion was a main component apart from her fleeting hallucinations. So why can't it be a delusional disorder? So eliciting the psychopathology in front of the examiners was a major task. Why? Because the patient was having so much of paranoia towards male people. So it was difficult for me to elicit it in front of the male examiners. But luckily, like daughter also backed me up, saying that these were the symptoms and she won't generally tell in front of male people. So this can be faced even in the current next session of exam, where in the long case, which is direct, patients can be paranoid to specific set of people. So maybe attenders backing up on us, or our confidence in how we present the case also gives the examiner idea that okay, these might be the symptoms, but even they know that not all patients will be comfortable in front of every examiner. So that was a challenge for me at that time. So that patient is not telling the same thing in front of the examiner what she told me. So, and then the next discussion went on to the guidelines management, and then because of the non-compliance regarding long-acting depot injections, and differences between like typical and atypical depot, what are they present in India, what are the things available, and main like extra discussion which went on is like rehabilitation. How do you guide them, considering it was exam center was scarce? So more of the discussion also included that how do you propose for rehabilitation in this patient and all. So that was for the long case. And the two short cases what we have got is, one is neurology, it is dementia. So the component, I mean, like the question they have asked is to assess for the cognitive examination of the patient. So there again, the problem is like the patient was severely dementic, and the basic interview is itself is a difficult process. And by the time actually we have I went to present the case, patient and attenders have actually absconded from the center. So it went on more like a virtual case for me, especially that neurology case. So discussion was mostly on types of dementia, differences between cortical, subcortical. That went a bit more in detail when once you start answering the basic questions. The questions were like genetics of dementia, and also there I couldn't go in detail. So that was, and then what are all the non-pharmacological approaches? How do you explain them for better daily activities, day-to-day activities to make them easy? What are all the things? What is cognitive rehabilitation? So these were all the things which were easier. So that is about dementia case. And then the third one, or the next short case, is OCD. So OCD, like the discussion, the patient was actually in remission. So the discussion is more again theoretical way. Apart from eliciting what are all the obsessions and all, it went to like why is it chronic, and what are all, it's more of how you treat resistant OCD and all. So it was actually easy for me because I have conducted a BST on TIPPS on treatment resistant OCD. So it was easier for me, but actually the questions were a bit tougher if you have knowledge only till OCD, and if you don't have idea about resistant OCD, questions might go in a tougher side. So these are the cases, one long case and two short cases, sir.
Right. Yeah, thank you, Shravanti. And so I'd just like to ask Vijay, did you have the neuroimaging EEG psychometric tests in your exam? Like how
And
Shravanti had?
In the OSCE component, they have not asked anything, sir, in neurology, but I think they might expect some questions on EEG and neuroimaging, CT imaging, the basic images in the OSCE component also, because in their webinar presentation, they gave a CT image. So probably might contain, but not sure. There is a very, very minimal chance of getting those things. And we didn't have a neurology case also in the examination for both ward rounds or else for the long case or the virtual case. That was the problem. The neurology bit was not asked at all. Psychology tests they asked in clinical psychiatry only what testing you might go to psychology and all. They did not ask specific instruments that what is this used for and what is this battery, what is this projective personality test and all. They just asked how do you approach for psychological testing in those cases. That's it. Because they as per NB at last time the stations were very specific. They did not give any scope for psychological testing at that time.
Right.
But there were questions in the OSCE about psychological testing. So there were questions on IQ testing, and there was a question on Rorschach, I think. So.
Right. And did you have any neurology case at all in all your short case or long case?
No, sir. We were not allotted any neurology case. The 4 short cases were technical, all psychiatric cases. The long case was schizophrenia resistant, a long duration of schizophrenia. And one more virtual case was bipolar disorder, sir, with multiple episodes and resistant bipolar.
Okay.
We did not have a neurology case in.
Did you have any child case?
Child case also no, sir. Child technically they were focusing more in the OSCE, sir. Child cases they were given scenarios of child psychiatric cases like autism, SLD. Even they asked about FDA approved drugs in childhood schizophrenia, autism, etc., etc. In the Viva, they asked more about child psychiatry because there was a separate set on psychiatric specialty. So they asked about child, but it did not have any case on a child case there in our center.
Okay, thanks, Vijay. So I think there are a lot of questions in the chat box. So now let us start taking the questions. Yeah, I think the first 2 questions we have answered. The Saba Anis wants to know whether questions on imaging psychological tests in EEG were there. So that we have discussed just now. Which guidelines we should stress? APA, NICE, CanMat, IPS. So is it expected in your discussions that you should quote treatment guidelines?
No, sir, it was not expected to quote the treatment guidelines. It was just expected on how do you approach the case. In OSCE also, they asked about how do you go through a treatment resistant depression case. Suppose how do you start clozapine? How do you start lithium? Maybe how do you what are your strategies in treatment resistant depression? But they're not specific to any APA or IPS. Any guidelines should suffice to give you an overview. They did not. We did not quote anything as per APA, NICE, or CanMat or IPS. Yeah. I have gone through only Maudsley guidelines at that time. So Maudsley guidelines book only at that time, which was very helpful. Most of the questions were from those things only. The pharmacological management was from Maudsley guidelines. Yeah, need not quote any other guidelines. Yeah.
Right. And Shravanti, were you expected to quote any guidelines in your answers?
Not exactly, sir. Like as sir have told, it's how you go to the management plan rather than specifying which guidelines which you are telling.
Right. Yeah. So generally, I mean, that is a basic principle of any exams, that you are really not expected to quote any specific guidelines. I mean, what is really assessed in an exam scenario is your clinical decision making in your clinical approach to the management. Generally, in an exam, they don't expect you to quote any specific guidelines as such for your management plan. So next question is, was neurology a part of any Viva section or case examination? Yeah, so that we discussed. I think Shravanti had neurology case, but I think in Vijay's case, they did not. There was no specific neurology case as such kept for the exam, but but you can expect common neurological disorders as part of the short cases. TIPPS OSCE, please share the link for it. So that is TIPPS OSCE notes is available on the TIPPS website, TIPPS. That is TIPPS.co.in. You just need to register on the website, and in the download section, it's available. The registration and download, everything, it's all freely available. Okay, again, neurology. What about neurology case? We discussed that. Any questions regarding clinical psychology? Yeah, so how much of psychological, psychometric testing, therapy, etc. questions did you get in your discussions?
Discussions, they were asking about CBT and also psychosocial management, and how do you approach, what are the psychosocial approaches present. They asked even about in a short Viva discussion, autism, how do you approach psychologically to autism case. What are the investigations you might use? What are the behavioral approaches which you can use? These were asked, but more on decision making rather than quoting any specific test or specific pattern of therapies. They were asking about how what can be done. That's it. So it all depends on how you take the case and how you approach the case technically. Because there was no particular station allotted for us for psychology, there are not much clinical psychology asked through in and out. Only it was about in Viva stations they asked about approaches and management, psychological approaches and management. Technically, they asked about, as I said, IQ evaluation and projective personality tests and behavioral approaches in autism. These were the questions asked for me, not much apart from these, and CBT in depression.
Right. So many management, I mean, whatever psychological aspects are required for management, that was mainly the
Yes.
focus. So did you have any theoretical questions about psychological theories of different disorders in a Viva or in the discussion?
No, sir. Not much.
You didn't have that. Right. And Shravanti, was that there in your discussion, psychological theories?
Theories, it was not
disorders?
asked about, sir, but as I have told, there is one station specifically for psychological testing. So almost like most of the tests like Rorschach and even the Tower of London test, other frontal lobe tests. So they were asked, at least they have shown me the test and you have to name it and for what you will expect them to do. So that was there for when I was giving the exam. And especially for this projective test, they have gone in detail, like what do you expect in a schizophrenia patient, like what are the answers you expect, which I was not able to tell. So yeah, projective tests, they have gone a bit detail, and all the other basic psychological testing, you should at least know what it is and in which condition or in which situation you do it, though not in detail about the procedure. And rating scales, common rating scales, they have asked like what are, apart from HAM-D, what are all the other rating scales for depression. So something like that they have asked regarding the rating scales.
Right. Yeah, so I mean, basic clinical psychology related assessments and therapies and psychological approach to management. I mean, the basics that are required in an MD exam would, I think that skills and knowledge would be required here also, even if it was not asked to Vijay in his particular exam, but in other centers, depending on who's the examiner, it can definitely be asked. Yeah, so next is please share the PPT of the presentation. Yeah, we will share the PPT that Vijay has presented on the TIPPS group. Was there any neurology case presentation? Yeah, we just discussed that. A couple of questions again on the TIPPS OSCE notes. As I mentioned that it's available on our website and you can access it there. Is the preparation and question pattern same for post-MD candidate?
Technically, yes, sir. It was similar. It was similar. What I did for MD exam, I carried out same for DNB exam. I just gone through ICD-10 mods like guidelines and some videos, as Shravanti said, OSCE videos were there, which were carried out last time by Icon Group and Spandana Institute, I think. There were about 12 to 13. I have gone on through only 2 on how the pattern was asked. I did not go into detail because I did not have much time to go into those things. That was the only extra thing which I did for DNB exam, apart from MD examination. That's it. Other recent surveys I have gone through MHCA, NMHS, NMHP, etc. Apart from that, it was not much different, but only the mark segregation is different. So I don't think in my question is much different. Only if you want orientation to OSCE component, you can go through those YouTube videos and volume or TIPPS OSCE volume.
Right. So I think, I mean, whether you're a primary DNB candidate or a post-MD candidate, I think the exam is the same it's the same exam that both candidates have to give. And yeah, I mean, and the skill, knowledge, etc. expected will also be the same. And so, I mean, so what I understand from the discussions till now is that the MD is a little gives more, an MD exam gives more importance to one particular long case wherein you have like 45 minutes to take the complete history and you're expected to present all aspects of that particular case, and the discussion goes in depth. A lot of time that one case receives a lot of importance in your final result. And I mean, that's like, if you generally, the saying in an MD exam is that if you are able to crack your long case, you can mostly be assured that you have cleared the exam. But here, from Vijay's experience and the DNB format, it appears that it is not so much dependent only on one particular case. So you get multiple opportunities. So it's more like a more all-round and a more holistic kind of an assessment, wherein they are evaluating not in depth, but they want to know whether your knowledge is wide, and whether in diverse scenarios and different cases you are able to give your clinical approach, and you're able to make a clear decision about management plans. Yeah, so the next question is, now exams are virtual. In contrast to previous, which was direct. I am post MD, so not closely following DNB exams. Yeah, so I think by virtual, I think the exam as such does not happen virtual, if I'm not mistaken. It is some of the questions in which are OSCE, or the one of the long cases which was virtual, in the sense that it was shown in the form of a slide.
Yes.
Yeah. So so in the notification which has come, is it mentioned anywhere specifically that the exam conduct of the exam also will be virtual?
No, sir. Sure. No, it was not mentioned anywhere. They just gave dates and they gave the mark distribution on the pattern of the examination. That's it. So it was not mentioned. And technically, in the webinar by DNB last time, they said that the center will be allotted as per your state of registration. Actually, state of your primary medical qualification registration. So most of the people were, because the travel issues are there, most of the people got their centers in their own state, which was not the case with Shravanti, I think.
Actually, I have done my MD in Tamil Nadu and I got registered there, so that might be the reason.
Yeah, probably.
Okay, because that is one of the anxieties of the DNB, because
language,
because you are given center somewhere else, and then communication language becomes an issue. So I think right now, at least because of the travel restrictions, it's more likely that you will get it in the same state, so that language issue is minimized. Any concise material on psychological testing? Yes, so on our TIPPS website, we have our STEP presentations, because every year in the STEP, we have a session on psychological testing. So the PPTs of those are available. You can access it there. In addition, any other material that you want to suggest for psychological testing?
Not really, sir. It should suffice. The PPTs and what you studied in psychology, Morgan and King should be enough. I don't think any testing material apart from it is, because they assess only the basics, not much into depth of the testing, or how each step of the testing and how it is carried out. They expect you to identify the test and how it is done, what is the use of the test, and or in which cases you do this testing. That's it. That should suffice. Not much into the depth of each and every test. It's because it's very difficult to cover most of all the tests. So psychological testing, I think the PPT should suffice.
Correct. Please share the existing materials in a folder if possible. So Yeah, I mean, on the TIPPS website, all the materials are there available in one place. You can look at that. And please, in addition, the other resources, I think what Vijay suggested were mostly books. So I think we can, Vijay can share that PPT so that you can have a look at that.
Yes, sir, sure. I'll share it on the group, sir, TIPPS group.
Yeah. Please repeat the name of the icon group, OSCE videos. So Shravanti, you can share that link on the chat so that
Yes,
they can
sir.
access
Yes,
it.
sir. Yes.
It is available on YouTube, if I'm not wrong. I think it's there on YouTube.
It's available on YouTube. It's a free website. I mean, link only. I'll share it in the group.
Yeah. So here in the chat box, you can put it so that people can access it. During the OSCE type exam pattern, was neurology part of the assessment during table Viva or ward rounds? Yeah, so that neurology, again, we discussed. If we haven't prepared so far, what are the absolute must reads in the last 1 week? Yeah, so what are your thoughts on crash course for preparing for the DNB exam?
As I said, sir, must read ICD-10 and Maudsley for sure. So child psychiatry synopsis and probably forensic and community psychiatry and national mental health survey, which most people neglect. These are the more specific areas because there were a lot of questions on forensic psychiatry, especially regarding RPWD Act, NDPS Act, even disability assessment ideas and all. So you should expect all these things. Forensic and community psychiatry, I think TIPPS volume might be done, or else if they have any specific presentations, they can go through that. And specialty psychiatry, child psychiatry, at least go through the synopsis and Maudsley and ICD-10. I think those are the last minute resources. Absolutely must read things in the last minute. The other things basing on your clinical decision making and all should get to you basing on.
Right. So, I mean, so if you're a post MD candidate and so you would have already prepared and you for most of the things, and you already will have the clinical skills that are required. Probably it is more of a revision and brushing up of all the basics, which includes psychopathology, nosology, and clinical approach to various case scenarios. And as from what Vijay tells us, it seems that a lot of importance is also given to community psychiatry, forensic psychiatry, and like the specialties. So that is something that should be also brushed up. Right. So next question is, do we have to carry stethoscope, hammer, torch, etc.?
Actually, it's always better to carry, sir, because we don't know if they will be present there or not. It's always better to carry. If they ask, they can put us in. Yeah.
Whereas they have expected an entire neuro kit to be present.
Yeah. So it's always a good idea to carry your tools, and because you never know what kind of case you are going to get. So let us say suddenly you get a neurology, like how Shravanti had a dementia case. Like Vijay did not have a neurology case, but it is quite possible that there can be a case there. And it's always a good idea to be equipped for for everything. And like how in an exam you're expected to carry the basic things that are required for a physical examination. I think it's always useful to have it with you. And are they also provided there? I mean, does the center arrange like a BP apparatus? And
if we ask, they are providing, sir. For us, if we ask, they have provided BP apparatus and all. Otherwise, they have not provided anything. If we ask specifically only, they provided. We took one knee hammer and a torch and a steth. So those are all the basic things we carried. That's it, and the ball pen, 2 ball pens.
Right. Yeah. So it's always better to go prepared. Yeah. So the next question is, for non-virtual long case, what was expected to be written?
Yeah, even if you write nothing, also if it is a virtual case, they won't. It won't matter because they won't be evaluating your answer sheets. It's just for your information on what to write and what not to write. Because they'll be asking questions basing on the slide presentation only. They'll not be checking the particularly, but you're expected to write whatever is there in the slide. But still, if you can remember most of it, you can just write your formulation, the positive points towards your diagnosis. That's it. Because they are not evaluating these things, they only evaluate the OSCE component. Other things are just for their reference.
Right. So the OSCE case, the OSCE answers have to be submitted, but for the long cases, you don't have to submit the sheets.
You have to submit the sheets. They'll be giving you blank sheets, but technically, if you don't write nothing, also it's okay. I feel, because I have written only positive points towards that. They were not evaluating; they were just keeping it as a proof that they have conducted the examination. Yeah.
Okay, so the long case sheets are not evaluated; it's more based on the discussion and the answers, and that is marked. So similar to an MD exam. MD exam also, you don't really have to write the case and submit it. Yeah, but the OSCE, yes, you have to write the answers, and that is what is evaluated.
For us, OSCE, the problem is they will take away the answer sheets also. The one sheet, if they are provided 20 sheets, they'll take away after each station. That is the only problem I have faced more particular to DNB examination. Other than that, it was more similar to MD examination. The only thing is within 3 or 4 minutes, if you want to write continuously, my hands were shivering at that time continuously. It was very painful to see the question, understand the question, then write something on the paper, and after 4 minutes they'll be taking away that blank sheet. Yeah.
And how many OSCE questions did you have?
We had 25, sir. We had 25. Now it is 20, I think.
20, okay. So 20 into 4, like almost 80 minutes.
Yes, sir.
Yes. So maybe that is something which is not there in the MD exam, and that is something which people who want to attempt DNB may want to practice that format. Yeah. So how can we tackle language barriers? So Shravanti, did you have language issues, or was there an option of an interpreter?
Like for me personally, I have done 3 years of my MD there, so I didn't have any problem with Tamil. But there is a translator for someone who actually have language. So when I have given the exam, there is one girl from I think Delhi or somewhere. So she got a center here. So she was allotted a translator, and also preferably a person who can talk Hindi. Like she was given a case where the patient can talk Hindi, so to make it a bit easier. Anyway, discussion, entire thing goes in English. Only with the patient, there is a translator, as well as they'll consider your language, and if there is a chance, they'll give the patient where you can understand the language.
Right. So do they beforehand, see that language compatibility and allot the cases, or you have to request?
Not exactly, sir. But like during the introduction, when I have given 5 of us were there, so they have asked if anyone is having problem with your language, do you need translator? That thing initially only they have asked. So based on that, they have allotted cases maybe.
For us also, they asked that for if we need a translator, there are PGs and interns who are able to traverse in the language, so to communicate the findings. So they will provide some translator, and probably they'll keep cases who are more versed in Hindi and the local language, rather than keeping only in their local.
Right. So generally some attempts are made to ensure language compatibility, or at least a translator is provided for the exam.
Yes.
Next question is how to go about the original long case in such a less time. Can't write a full case due to the time constraint. Do we only write point-wise and not explain HOPI?
Yeah, see, whatever you write in the a sheet is no matter how much short or how much long you write, it's okay. The thing is, you should remember the presentation of by your case. History of present illness, if you can remember past history, what are the positive findings and negative ones. In such a less time, it's more probably vocal, and you can write your positive points on the answer sheet and you can submit that. That's what I feel, because you won't get time to go into detail with HOPI, past history, and and write these on a paper. So within the 30 minutes of time, I think you can go with the positive points and you take your own history and go with that. Yeah, that's what I feel.
So very expected to
Because
present the full. Very expected to present the full HOPI like in an MD exam.
Yes, sir, almost
almost they were asking, sir. Briefly also, if there were some shortcomings also, they accept that, but still you are expected to do a HOPI and past history also. Yeah. Because it's a long case, they expect everything. In ward rounds they did not expect, but in a long case
it is expected. Yeah, Shravanti, you were saying something.
So even it might not be a point or something can be missed, but entire HOPI they do expect.
Yeah, so at least in the long case, yes, it is expected that you present the HOPI. So similar like how in an MD also you have limited time, 30-40 minutes, in which you're expected to take all the information. I think the same applies here as well. But you don't have to really write down the whole case. You need to have points for your reference, which you can use to present your case. What were the topics of the OSCE stations?
Yeah, the topics were almost they were. My first question was close-up in, sir. Technically, my first question was close-up in. They asked about how do you initiate close-up in, what were the levels of the close-up in you would expect, what are the common side effects with close-up in, what were the serious side effects with close-up in. These were the 4 set of questions in the session, and particularly the questions are like this, especially mostly on management plans and drugs only. Clozapine, lithium, valproate, what are used in pregnancy, etc. Yeah, and also there were recent FDA approved drugs, what are the FDA approved drugs in child? What are the recent FDA approved for drugs for treatment resistant depression, etc. Those were asked. Technically, mostly OSCE stations were of more of clinical, but they have asked some stations with the history of psychiatry also. They gave a picture of the first center where psychosurgery was carried out. There was also a question on disability assessment ideas. There was a question on NMHS, how much treatment gap was found. So technically, it was a whole all-round approach rather than just sticking to the clinical cases. OSCE stations were.
Right. And was there anything on biostatistics?
Biostatistics, no, sir. There was not a question in OSCE.
No question
also.
in
Not asked. Yeah.
Yeah. So generally, I mean, in practical exams, questions on statistics are not asked. It is usually a part of the theory exams. How to join the TIPPS group? So we have a Telegram group on which there is active daily academic discussions happen. So if any of your friends are on that group, you can ask them to add you, or you can mail us on tipsinfo@gmail.com. We will send you the link to join. And in addition, we have the TIPPS website, tipps.co.in. You can access that and you can register by yourself for free. Do we need to carry logbook and thesis with us?
In admit card, it was specifically written for us, sir, that no need to carry your logbook and thesis. I don't know what this session, how this session will be. Yeah.
Okay, so just follow the instructions that are given in your admit card. I think this is more applicable to primary DNB candidates. Any questions on ICD-11?
ICD-11 in Viva recent advances they have asked. ICD-11 was asked on specifically mostly on the changes you expect in ICD-11. What are the just one or two questions, not much of, just that how it has been changed. What are the new diagnostic categories in ICD-11? Complex PTSD and where the burnout is, and in schizophrenia the subtypes were more basic questions, not into depth on the criteria and all. Yeah. The major changes only they ask.
What about DSM-5? Was
they were not
asking differences between ICD-10 and DSM-5?
No. They did not ask. They did not ask. They did not go into detail about the criteria. Just that for your long case, they expect the criteria to be fulfilled. Other than that, they have not specific differences.
Right. And I think the last Question is, ward rounds, all 4 stations have discussion.
Yeah, ward rounds is technically they allotted 4 cases before, sir. Each station had 1 case. They allotted the 4 cases to us. Then one examiner was taking 1 case. So all cases were discussed. All the examiners were not asking all the cases. One examiner for 1 case.
Okay. Can we choose the state for practical exams?
I don't think it's as per DNB, sir. We don't have a choice of charting or center or state.
Right. And what cases should we expect for long cases?
Any long case you expect in an MDMS exam or in your DNB, the generally are schizophrenia, resistant schizophrenia, resistant BPID, OCD, which have long-term course, so chronic and relapsing course or chronic course will be asked generally. These are mostly the long cases. I faced in MD also same schizophrenia and bipolar cases only we had in DNB also we had one schizophrenia case for long case, and then some people had bipolar type 2 particularly with severe depression with suicidal ideation, and virtual case was of bipolar disorder. So technically schizophrenia, bipolar disorder, OCD might be your long case probably. These are 3 major things which are expected. Other cases can be asked, but these are three cases which have long history and long treatment. Yeah, so probably these cases will be asked for long case.
Yeah, so I mean generally any case that is typically kept in an MD long case exam. So usually these are cases which either have a comorbid diagnosis or they have a psychopathology for discussion, or they have a management issue for discussion like treatment resistance. So typically these are the cases that are kept for the exam. I think that you can expect the same in the DNB. So I think type of cases I don't think will change between MD and DNB. Summary and diagnostic formulation, whether it's needed for long cases.
Long cases, if you see whatever you write on the paper, it's okay, but whatever your presentation will be, they expect either summary or diagnostic formulation at the ending for long case.
Yeah, for long case, so I think the diagnostic formulation is probably the most important thing that you need to present, because then that leads to the diagnosis and the management plans and the discussion related to that. From where to study prevalence. So I think Vijay has mentioned that in the National Mental Health Survey, there was a lot of importance given to that, and that is the latest source for all prevalence related data in the Indian context. How much was de-addiction related topics asked?
De-addiction related topics asked were very lesser, particularly how do you quit nicotine and alcohol de-addiction only we were asked, because they are more prevalent here. Only those 2 were asked, not about opioids and other de-addiction. Yeah. Probably it was very for very short times, very short. Because in Viva we only have 5 to 10 minutes. They'll ask in that time only very specifically.
Yes, Shravanti, you were saying.
Like only in the psychopharmacology part of Viva, like that station only, mostly the drugs were asked, and it is generally alcohol and nicotine. That's it.
Right. Yeah, I mean, but you can still get a long case or a short case which is substance use related, and there obviously then the discussion would be on the substance use. Right. Yeah, so I think this was a very useful discussion. Thank you, Shravanti and Vijay, for all your insights and inputs. Yeah, so lastly, I think somebody has asked TIPPS Telegram group name. Yeah, so the name of the group is tips.co.in. I mean, I think I would suggest that you just send us an email on tipsinfo@gmail.com. We will reply with the link to the group, and you can join that. You need to have the Telegram group, the app installed. Right. So overall, I think to summarize, I think so this time's pattern is probably is going to be similar to what Vijay had in September 2021. right? So wherein because of the current COVID wave, I think again the focus would be more on trying to minimize the interaction or the contact between the patient, and it might also be difficult for them to get the real actual patients. So maybe a few patients will be kept for long cases, but most of the other assessments would be through case vignettes, OSCEs, and Viva. And overall, I think what I understand, I have never given the DNB exam, so it is a lot of learning for me also as to how the pattern is. But from what I can understand is that the knowledge and skills that are required are not very different from what we learn in an MD. The same preparation that you do for an MD exam will hold you in good stead for the DNB exams as well, because the basic skills of formulation, management plan, approach to diagnosis, etc., is not going to change. The difference is more in the approach, in the sense that in an MD exam you have more focus is given to a single long case, but in this current format it is going to be not going into too much depth, but looking at more how broad your knowledge is. So it's like the old saying that you have, that you need to know something about everything rather than everything about something. So I think that if you keep that in mind, I think one should be able to crack the DNB exams. Right. So I think if anybody has any more questions, please feel free to post your questions on the TIPPS group. And so Shravanti and Vijay will be available on that group, and we can always answer your questions there. And we'd also like to remind everybody that we are conducting our annual STEP 2022. Last year we could not conduct it because of the COVID. We thought that the COVID waves will improve, and then later in the year we'll be able to have the physical conference, but unfortunately that did not happen. And in the current scenario also, a physical conference looks difficult, though I know that everybody is waiting to go back into the physical conference mode, but we'll have to do STEP 2022 online. So what we have planned is that we will be having a series of 6 workshops over 3 weekends. So, and each will be not more than 2 hours every day. So it will not be taxing like other webinars or conferences where you have to sit and attend the whole day. So this is just only 2 hours every day, and given the busy schedule of all the PGs, I think it would be more convenient for them also to attend for short duration. So it will happen over 3 weekends. And so all those who are in the final years and going for the exams, I think do have a look at it, and if you think that will be useful for you, do attend it. Okay, so thank you so much. Thank you everybody for your participation, and we'll share the PPT. We have also recorded this, so we will also share the recording of this session so that those who could not attend can also have a look at it.
Thank you, sir. Thank you for the opportunity, and I wish all the best for DNB giving students.
Yeah, so all the best to all those who are attending this meeting and who are going to give their exams on the 3rd of February. All the best.
All the best, everyone, and thank you for the opportunities.
Yeah, so all right, so happy Republic Day to everybody, and all the best for the exams. So we'll end the meeting.